Once you have navigated to the General Information section, select the drop-down menu of the second question. You will notice that this menu offers two options to choose from, in person and by phone or telehealth video. These new choices expand options for how patient information will be gathered. When initiating an assessment in person or via telehealth video, you usually have an opportunity to observe and assess certain aspects of the patient's medical status or clinical presentation. This assessment ability is limited when performing an assessment over the phone. Whether by phone or telehealth video, there are times that you may have to rely on the patient self-reporting. There may be situations where you or your patient will be unable to determine a medical status, even if you can observe the patient in person or through telehealth video. In such circumstances, you can select the Unable to Assess option, which has been added to drop-down menus in other sections of the tool. Navigate to the Medical History section by selecting it from the panel on the left side of the screen. There are 3 items in this section that now features the option to indicate that you are unable to assess a specific medical aspect. The first item where this appears is in the drop-down menu for the question, how much medical or nursing care or physical rehabilitation do you need? The second item asks, how would you rate the patient's need for medical treatment, and features a rating scale. The Unable to Assess option is at the bottom of the scale and is not assigned a numerical value. The third item where the Unable to Assess option appears is in the drop-down menu for the question, is there a reemergence of acute symptoms that can be safely addressed only in a medically monitored setting? Navigate to the Drug and Alcohol section using the panel on the left side. Updates have been made to the Clinical Institute Narcotic Assessment for Withdrawal Symptoms, or CINA, and the Clinical Institute Withdrawal Assessment of Alcohol Scale, or CIWA, to guide you when assessing patients who may be experiencing withdrawal symptoms. Click on the CINA scale for opioids section. There is a blue info icon next to most items. Several of the info icons have been updated with guidance when an interview is conducted by phone or through telehealth video. When interviewing the patient regarding the presence of goose flesh and sweating, hover over the info icon. The guidance has been updated to prompt the patient to observe if sweating is present and to what degree. Next, hover over the info icon for the item that begins, please raise your arms straight out in front of you. The info icon has been updated to guide the interviewer by asking the patient to touch their own fingertips together lightly to ask if they feel if any tremor is present. For the next 3 items, lacrimation, nasal congestion, and yawning, hover over the info icon. It has been updated with guidance to ask the patient to observe if symptoms are present and to what degree. 3 drop-down menu options have been updated to reflect a response based on a patient's self-report. When assessing abdominal changes, click on the drop-down menu. The first option has been updated to no abdominal complaints, and if assessed, normal bowel sounds. When assessing changes in temperature, click on the drop-down menu. The second option has been updated to reports feeling cold, hands cold and clammy. When assessing muscle aches, click on the drop-down menu. The first option has been updated to reports no muscle aching, arm and neck muscles soft at rest. Click on the CIWA Sedative and Alcohol Scale section. 2 of the info icons have been updated with guidance when an interview is conducted by phone or through telehealth video. Hover over the info icon for the item that begins, please raise your arms. The info icon has been updated to guide the interviewer by asking the patient to touch their own fingertips together lightly to ask if they feel if any tremor is present. Next, hover over the info icon of the item, paroxysmal sweats. It has been updated to guide the interviewer to ask the patient to observe if sweating is present and to what degree. The narrative report now indicates if the interview was conducted by phone or telehealth video. Scroll to the General Information section. The first paragraph has been updated to indicate that the report will contain some patient self-report data. The summary report also features language updates. On the cover page, the note will state at the bottom of the paragraph, interviews conducted via phone or telehealth video will contain some patient self-report data. Next, scroll to the Critical Items section. If the patient or interviewer was unable to assess the need for medical or nursing care or physical rehabilitation, the need for medical treatment, or whether there is a reemergence of acute symptoms that can be safely addressed only in a medically monitored setting. The report will recommend further assessment by a medical professional.